Atlantic Reproductive Medicine Specialist is a fertility clinic located in Raleigh, North Carolina. The clinic was founded by Dr. Susannah Copland and Dr. David Walmer. Together, they take a visionary approach to personalizing fertility care with the most advanced assisted reproductive technologies. We got to sit down with Dr. Copland and ask some of the most trying questions about fertility specialists. In this brief podcast, Dr. Copland talks about what a fertility specialist is, when to call one, and what to expect on your journey to a healthy pregnancy. Good afternoon, Dr. Copland. Thank you so much for meeting with us. To begin, we all know that facing infertility is something that is a challenge for many couples. Would you please talk to us about what to expect when working with a fertility specialist and what happens when a couple or a family engages one for help?
Yes, so fertility specialists are people who initially trained in obstetrics and gynecology in the full range of women's health, from delivering babies to helping people go through menopause. But then they made a decision that they wanted to focus discreetly on that period of life when women are attempting to build their families and helping them negotiate through some of the different challenges that can occur if we don't get to pregnancy quickly. And so everything that we do really focuses around building families. And when a woman comes in to meet with me, or a couple comes in to meet with me, they are usually coming because they have identified that it's taking them longer to get to pregnancy, or that they've gotten to pregnancy but had miscarriages, and so they're not getting to live birth. And they're coming to say, what can we do to, take this to the level where we can have a baby? And that's when we usually start doing some in-depth discussions as a prelude to doing testing, and then determining what type of treatment might be helpful.
Now, is it common for couples or a woman to meet with more than one fertility specialist, or do the couples tend to stick with the same fertility specialist throughout the course of achieving a live birth and pregnancy?
I think most couples are identifying, the pathway that will meet their needs, and so sometimes that's straight to the right fit, a fertility specialist for them, and sometimes they try out a practice and then learn a little bit more about what they are looking for and then move on to a different practice. I would say that most women and couples start out with their OBGYN because as young women, we get exposed to the need for annual health care with an OBGYN. So, in many cases, the first place they start is going to the person who's been doing their breast exam and pap smears and saying, I'm having a concern with delayed pregnancy. And many OBGYNs feel pretty comfortable doing some of the early testing, but some don't. And so in our office, we see a mix. We see some patients whose OBs have said, you know what, I want you to go straight to fertility. We see others whose OBGYNs have already done testing. And we see some patients, because they can find out so much information online, who kind of skip over their OB saying, well, I'll get back to him or her when I'm pregnant, but for right now I want to go straight to a fertility provider. So we do see a mix.
Mm-hmm. Do most couples, what would you say is like the time or the indication that a couple would feel like you were talking about skipping the step of their OBGYN? Is there like a certain time frame that couples, face, a couple of years, or how would I know if I needed to necessarily meet with a fertility specialist? What would be the indicators, would you say?
So part of the things that are discussed at Women's Annual Wellness is this. If a woman expresses to their OB, I'm interested in pregnancy, one part of education at that meeting is to say, most people will be to pregnancy within a year of unprotected intercourse. And but because fertility declines as women age, since the majority of people actually get pregnant in the first 6 months. People who are actively trying to target that moment when they're ovulating, you will see a majority of folks get pregnant in the first 6 months. For a woman over the age of 35 who has less time to try to conceive, the recommendation is that they go to see a fertility specialist if they're not pregnant by 6 months. For a younger woman who's under the age of 35, the recommendation is to try for a year, and if not pregnant, go to see somebody. Now, some folks know that they're probably going to need to see somebody. So that woman who says, my periods were horribly irregular, and then I went on birth control. Now I've stopped the birth control pill to get pregnant, and I'm not having a monthly period. She's going to arrive sooner. Or a gentleman whose mother told him, when you were a child, your testicles had not descended appropriately. You had surgery, and the pediatric urologist said you might have problems fathering children when you're older. Like, those gentlemen know that they need to meet with someone sooner. So sometimes people know that they need to meet with somebody sooner, but if there's no historical concerns with regards to surgeries or infections or irregular menstrual cycles, the recommendation is generally that women under the age of 35 try for a year, and women 35 or older try for 6 months and then go see somebody for testing and assistance.
Now, for couples particularly, is there a way to know if it's, oftentimes you'll hear, it's who's at fault, who's the one that can't conceive? Is it possible for partners to tell that themselves, or how would you recommend that they approach that if they're unable to conceive as a couple?
So from the standpoint of the diagnostic evaluation, our goal is to look at the main things that we can test. And the main things that we can test, we can answer these questions. Are there eggs? Are there sperm? Is the uterus a good place for a baby to be? Is there a way for eggs and sperm to get together? So essentially looking at ovaries, uterus, fallopian tubes, and sperm. These are the main factors that we can test. But we know that there are a myriad of mysteries that Mother Nature has not shared with us. There are fine details in all these systems that we may not have tests for. So when people come in for fertility evaluation and they're looking for the answer, we all like to be able to solve mysteries. But sometimes we do the testing and we find that everything's absolutely normal, and we know that there is a factor, just one that we don't have a test for. Other times we find that there's multiple factors. Maybe the semen analysis has a few abnormalities. Maybe the menstrual cycles are a little bit irregular. Most times we try not to focus on one person or the other. We tend to focus on these fertility factors because from a medical standpoint, sometimes it really is just one thing. Tubes are blocked. Eggs are fine, sperm are fine, uterus is fine, but if tubes are blocked, we can get around tubes. Or some gentlemen are born, with the inability to ejaculate sperm, and so there's no way their sperm are going to see an egg unless we help. So sometimes we have some pretty obvious barriers, but many times it's a shared diagnosis. And from the standpoint of the couple's head and heart, to let them know that we're not looking for the one thing to blame, but more to look for the assets they have and the challenges that they have, and then figure out the pathway that's going to get them to their baby without focusing too much on, what side of the male-female equation it is, alleviates some of the stress.